The Health by Motorbike project started out of the idea or the desire of my own students who wanted to apply what they have been learning in the classes that I teach. I teach classes on global health and human rights, and the students wanted to take it a step further and wanted to work abroad. So we started seeing some possibilities of working in rural areas, and we found a perfect location to apply what we have been learning, that is the rural area in southeastern Kenya, a few kilometers north of Tanzania.
Global health really looks at issues that transcend borders, issues that influence health outcomes besides just access to health care, such as economic and cultural and educational and political influences on health. So it's really a very broad and evolving concept, but one that gets a lot of people excited.
We think about the way that all the different sectors that might contribute to well-being contribute to health as part of global health. So water and sanitation systems, environmental care, everything that contributes to human flourishing in terms of health, education, and even economic well-being are part of global health.
What is more different, not unique or new, but is different of the Health by Motorbike is that we have a very comprehensive approach to health. We bring health literacy. We train local women to become health promoters in their own community, and these health promoters are going to train other health promoters in the community. And something that is also different is that we provide services at the same time that we bring health literacy, thinking that when women learn, they need also a follow-up. So they have a public health nurse that is going on motorbike to remote areas, especially 3 locations, Lunga Lunga, Kodo, and Perani. The other component that we have just added is the research component, because the project has started in a university setting. We have managed to create the 3 components, the education, the action, and the research. And there is one student right now who is doing research on malaria and gender. Also, because my training is in gender, we give the gender approach to everything we do, meaning in gender that we take men and women and the relationships of men and women within the family, within the community, what they do. And we have realized that it's mostly women, the caretakers of the family, the caretakers of the community. And that's why we are targeting the women, because they are also the producers and the reproducers of life, the reproducers of health, and the reproducers of culture. So they are the ones who train their own children, who train other community members. But in some ways we also target men, and men realize that their own families, the health of their families is improving. So men also want to be part of this project. So the project is not new, but it's different because of these 3 different components. And it's also new because in the area it's totally new. There was nothing in this isolated area of southeastern Kenya. There is my partner or our partner community, Project Africa, has already a project going on, but health has been absent. There is 1 clinic around, only 1 clinic, and the women and men and children in Godo and Perani cannot reach the clinic, or they have to walk more than 12 miles walking on foot or riding a bicycle, and for a pregnant woman that's not very feasible.
One of our aims is to really promote sustainable projects that can keep going, and we found some elements that are really key for sustainability. We found in our partnerships for health that a good deal for Wisconsin has to be a good deal for the host community. Otherwise, it's not sustainable unless both sides are gaining benefits. And the benefits may be very different. our students get learning, but the Kenyan communities get essential services that are greatly needed and training opportunities for their local leaders.
The goal of Health by Motorbike right now is to make this project sustainable and to make the communities of Lunga Lunga, Godo and Perani to own the project. And to make it sustainable, we have started several activities. The first activity was to develop summer health camps for women and adolescent girls in the three communities, in Lunga Lunga, Godo and Perani. We ended up doing one more in Nairobi for 700 women from the slums of Nairobi on reproductive health especially. The health camps in Lunga Lunga, Godo and Perani were also basically on reproductive health, but we also targeted malaria and other infectious diseases that are very endemic in the area. We gave the women an incentive because we know that women are very busy, they are workers, they have families to raise, and they cannot afford just to listen a training. And this incentive was a little bit of money and a little bit of food at the end so they could feed their own families. And at the end, we celebrated the three communities, we together celebrated the end of the summer health camp. But we also managed to launch the Health by Motorbike project that is bringing a clinic to the communities that are not reachable by any other means, like the Godo and Perani. And the other project that we managed to create was a permanent health clinic called Nikumbuke, Remember Me in Swahili, that is open for the three communities and is working now.
I'm really excited about Health by Motorbike. I think it's wonderful that they've included health literacy in the project. It's so empowering. We're a public land-grant university. Our mandate from the beginning has been to use knowledge, use discovery to improve the lives of rural people.
I think the real key is how to engage local leaders in owning the idea, investing in it so it becomes their project as well.
My students and I got the Wisconsin Idea Grant to distribute mosquito nets to prevent malaria. This is an area where malaria is endemic. We bought 50 nets and distributed the nets according to the needs of women. There are not the same needs that we thought the World Health Organization suggests. We started distributing the nets to women who have reached or passed the age of 40. They were menopausal women. So the menopausal women were the ones who told us, we are not in reproductive age anymore, we cannot afford the mosquito nets in the market, so we have no mosquito nets, and we are the target of malaria in this community. Instead of buying the nets, we bought the materials, and we used the 3 sewing machines that Project Africa counts in Lunga Lunga. We are going to distribute a number of mosquito nets free, as the World Health Organization suggests, but we are going to have also a supply of nets that can be bought by women and men whenever they think they need it.
Ready to represent that point.
Building personal relationships with people and just caring about them as friends, maybe treating people like you might treat your own family is just such a big part of, honest and I think just engagement. And our students just do that naturally. They don't, often will go to rural settings and, we might be tired or uncomfortable, but the students are always saying they wish they could have stayed longer.
We started establishing these relationships in order to keep working with these communities so the communities trust us. And something that we didn't expect is that the men have seen the improvement or the empowerment in women, how their families have improved, and they also want to be part of it. We brought many glasses for women, and the men in the community said to me, you have to bring for men too. If it's a gender project, it has to be for both, for men and women. Something that we also did is to have a very good relationship with the doctor, with the director of the only clinic in Lunga Lunga. And now the director of the clinic, Dr. Ishmael, is collaborating with us, and we are collaborating with him. And my intention is that the students that I bring to Health by Motorbike in rural Kenya not only work with the Health by Motorbike and Project Africa in this area, but also work with Dr. Ishmael in his clinic, and he has a research post, and he also uses a motorbike to reach the Maasai communities. So my students can go with me, with the leaders of Project Africa, the leaders of the communities, and also with Dr. Ishmael, who is a very, very well-known leader in the community. The project has shown to be very successful so far. It has changed lives in Lunga Lunga, in Godo, and Perani for the women, children, families in these three communities. It has changed the life of the students that I brought, and definitely it has changed my life. We need to keep this project running, and we need the support of many people. And we also would like to thank all the supporters that we had for these 2 years. And we can start with the students, my own students, who have been fantastic, the individual donors that have provided the medications through the year, the Rotary Club West in Madison, Wisconsin. We also would like to thank to the Davis Foundation for Project for Peace. A special thanks go to the Wisconsin Idea Grant from UW-Madison. And of course, a special thank go to the Department of Gender and Women's Studies, my own department, and the Center for Global Health. Without their support, this project would have not been possible. They have supported my bold ideas that they started very, very, very little, and they have been the real supporters of this project. So thanks to them. And we need their support to keep the project running, to keep the motorbike running for many, many more years.